Welcome to our Insight series on organizational well-being. Our question for this week is, what are the intermediate results of an employee wellness program? Number 17. Our focus this week is in answering the question, what are the intermediate results of an employee wellness program? And again, we are looking at the third in a four-part construct for the logic of employee wellness programs. Now, as we think about the intermediate results of an employee wellness program, we want to look at behavior change as one of those intermediate results. And you can use cohort data from a health risk assessment. And cohort data simply means we take the people who completed it last year and compare their own result to what they report this year. And then we can see what the changes are that are taking place in those people that are participating in our wellness program. We also can use program participation data. So that's another type of data that we can use to show what people have actually participated last year, this year, and that tends to follow the overall evaluation results of what we may be observing about our employee wellness program. Another type of data that can help us identify those intermediate results is using tracking data from whatever health management process items and categories and tools where we use in our wellness program. So these three areas indicate the type of data, specific data, that can help tell us what is happening in terms of the behavior change of the people that are involved in the wellness program. The next area we generally look at as intermediate results are there any indications that people are getting healthier? And the way that we look at that is we can again use some cohort screening or biometric data. And that means we take their previous biometric score or screening result and then compare it with their current one. We also can use and utilize some aspects of claims and healthcare claims in our health plan. So we can use utilization measures like days of hospitalization, use of physician visits, use of emergency rooms, urgent care clinics, and so on. And we can also use claims data, which actually usually takes a diagnosis and then compares and identifies what procedures were carried out for that individual. And that's what we call the International Classification of Disease Agreement, the ICD-A. Right now we're implementing the 11th edition of that nationally in the US. We can also use cohort data from the health risk assessment or health surveys that are used, or we can use a separate survey to follow up on specific issues that deal with the health status of the people that are in the wellness program. So that's the second kind of intermediate result from our employee wellness program. We also can find out how does the person perceive their productivity, or how, if we have any productivity quantitative measures, how is that changing for the population. And we can use objective secondary data from things like production systems and a variety of data systems if in fact the work unit or the productivity of the specific individual is translated into a quantitative base, an index, something that tells us how productive they've been. We can also use primary survey data, so we can ask them questions. There are a number of questions that are available in the occupational health area that have to do with their perception of how productive they are. And we often use what's called a Likert scale. So it gives us an ability to look at the percentage of the population that may perceive themselves to be more productive after participating in the wellness program. We can also use health risk assessment or separate survey data that's structured in a way that allows us to look at the intermediate result of productivity. So in summary, these are in fact the major intermediate results that we usually want to see in a wellness program between the actual use of the program, participation in the program, and then the ultimate results, which we're going to look at in depth next week. So in summary, there are intermediate results of employee wellness programs that can be used to help establish the cause and effect relationships between your employee wellness program and some observed kinds of issues like changes in your health claims costs or changes in the actual health improvement of the individual. Now, this is the third of the 4 constructs that we essentially look at as part of the results-driven logic framework for employee wellness programs. And again, those are, the first one we looked at were the needs and targets that we choose for our program. The second was the 6-step planning process that helps us come up with a set of targets and interventions. We then implement those, and then this third construct are the intermediate results that we can oftentimes find and observe that help us get a sense of the effect of the program on the workforce and the workforce health. And then finally, and next week, we're going to look more deeply at the ultimate results that we would like to see from an employee wellness program. For more information on this topic, try putting the following search strings into your web browser: intermediate results of employee wellness programs, measuring the effects of employee wellness programs, and evaluating employee wellness programs. Next week, we'll be addressing the question, what are the ultimate results of an employee wellness program? For more information, please feel free to visit our website at www.chapmaninstitute.com.